Our stroke patients in Jurong now have a new rehabilitation centre right in their neighbourhood. The latest edition aims to meet the rising demand and shorten those waiting times for patients.
In Singapore, at least one person suffers from stroke every hour, afflicting anyone from 18 to 80 years old.
This simple action, which many practice daily, can be an uphill task for stroke patients, especially as they regain motor capabilities post-stroke. And volunteers from Stroke Support Station will be helping them with the opening of its second rehab centre at Jurong Point. The new facility is twice the size of its first centre at Lengkok Bahru and will boast overall patient capacity from 450 to 1,250.
We need to work with our partners in the public, private and people sector to improve the quality of life of stroke survivors. We want to support them in different ways, in rehabilitation, in employment, and in their interactions with their social and physical environment, so that they can stay meaningfully engaged and live independently at home and in the community.
Patients undergoing rehabilitation are aided with motorized devices to improve their mobility and speed up recovery. A unique combination of gaming elements, artificial intelligence and sensors also work seamlessly to recover the loss of hand functions. These are part of the rehab process, which include restorative exercises and personalized fitness routines.
I'm more independent now. Before that, I can't even stand up, I can't even walk properly, which means that there's a lot of fear when you walk there, or fear of falling, fear of being, of tripping on small little areas, small little stones. So the confidence is there, more stable, stronger.
Apart from patients, caregivers can also receive support from the centre.
We will try and introduce what we call respite care, so that these caregivers can have, let's say, half a day off at least once a month, where they can leave their patients with us safely, and that they can go and do their own things. Some things that many of us take for granted, because sometimes caring for stroke patients is a 24/7 job.
The centre also intends to introduce speech therapy programs to tackle post-stroke problems in patients, such as swallowing and speech difficulties.